I can talk about the what soy does in the body at a biologic or molecular level, and then what are the studies about soy? Because I think those are two important things to really understand if you want to really grasp the fact that soy is not only not harmful for you, but that it's beneficial.
Mm-hmm.
So
This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life. Let's get started. Dr. Rizwan Bukhari is a vascular surgeon who has been in practice for over 25 years. He specializes in the treatment of blood vessels and is particularly passionate about limb salvage work and preventing amputations. He has also adopted a nutrition focused approach to treating his patients, which led him to learn more about soy. As part of our breast cancer awareness conversations, I asked Dr. Riz to speak about common soy myths. He will explain phytoestrogens, how our bodies use phytoestrogens, and what the data says about the use of soy products throughout a woman's life. As always, you can find the full bio and details of our conversation at the website healthylifestylesolutions.org. Let's meet Dr. Riz. Today I have a special guest. He actually started the podcast with me. So if you go all the way back to episode number 1, you'll see Dr. Rizwan Bukhari was my co-host. So welcome, Dr. Riz.
well, thank you very much. It's nice to be on the show again.
Thank you for making this happen because I think it's probably been over a year since you've been on the show. I don't remember. Um,
Yes, definitely.
for my listeners, we are in the same room in our home, in my home studio. And this is the first time that we record together this way with this setup. So we've come a long way compared to the first episode.
Absolutely. I remember the first episode was recorded in a hotel room with a single mic, I think.
Uh, no, we did do 2 mics, but there was something wrong with the recorder. And so when you listen to it, you can hear me say on the right ear and listen to you, it's the left ear or something like
Oh,
that.
yeah. Okay.
Yeah.
Yeah.
So I just watched it recently because I'm putting together a video for the listeners and for anybody who wants to view it on YouTube. I'm putting together 4 years of content. I'm not putting everything, not 230 episodes, but I'm going to highlight some things. And I thought, well, this is actually really cool. You're joining me right now to address Breast Cancer Awareness Month, and you're joining me at the same time that I'm celebrating 4 years of doing this. So
Good timing.
yep. All right. So before we talk about breast cancer, and this episode is airing in November, we had difficulties. Plus, we were traveling a lot, but I thought the topic of breast cancer should be a year round topic. And also the concerns that people have around soy, I thought we could also talk about. But before we do all that, I thought I may have listeners that are not familiar with you because I've been doing a lot more since the last time you joined me. So let's start with who you are. Tell us a little bit about yourself. How long have you been in practice? Where are you in practice? And what does a vascular surgeon do?
Okay. All right. So, for those of you who don't know me, my name is Rizwan Bukhari. I'm a vascular surgeon and I practice in the Dallas area in Texas. And I've been in practice for pretty much 25 years now. I started in 1998. So, 24 years. I've been a surgeon since 1991 when I started my training. But I did general surgery and then I specialized in vascular surgery. And I started my vascular surgery practice in 1998.
Can you tell us what a vascular surgeon is? Because we have even friends today that still call you cardiologists. They believe you're a cardiologist. So I thought we could talk about, what is a vascular surgeon? The average person may not have a vascular surgeon that they have to go to, but everybody knows about heart disease.
Yeah, I mean, so I guess I can understand that it's not a well-known specialty. There's not a lot of vascular surgeons out there. I think there's probably a little over 3,000 board-certified vascular surgeons in the entire country.
Wow.
And it is fairly highly specialized. We very specifically work on the blood vessels of the body.
Mhm.
And It's an evolving specialty. Early on, and when it was first starting and wasn't highly recognized, it was just a surgical specialty,
Mm,
and so people would clean out blood vessels or do bypasses on blood vessels. And it has evolved throughout the years, and especially in the last couple of decades, has become a specialty where it's the surgical treatment of blood vessel disorders. It's also the minimally invasive treatment of blood vessel disorders, so using stents or balloon angioplasties or other modalities to clean out blood vessels. And then it's also the medical therapy or medical treatment for blood vessels. And to be very specific, I treat all of the blood vessels in the body, or a vascular surgeon treats all of the blood vessels in the body, except for those in the heart and in the brain. But it's still the same disease process. When we talk about heart disease, or we talk about atherosclerosis, we're talking about plaque buildup in the arteries. Now, granted, there are some other areas in the specialties that treat other kind of things or
mhm.
diseases related to blood vessels. But when we're talking about that, the majority of the disease that we treat, both as cardiologists and as vascular surgeons, is atherosclerosis, which is the
Okay.
buildup of plaque inside arteries or causing blockages,
Yeah.
and then the bad effects of those blockages. And then also, I'll add that there's also someone called the cardiac surgeon or heart surgeon who does the heart bypass operations on the heart. If you think about what a cardiologist and a heart surgeon do for the heart, I do both roles for the blood vessels in the body. I'm both the medical doctor and doing minimally invasive therapies, and I'm also the surgeon who does the bypasses and cleanouts and things
Wow.
like that.
That's pretty cool. I'm familiar with a lot of what you do because I hear the stories. And I've often said, oh, if you could only share that story here on the podcast so that people can get a better idea of what you do. So you are, I think we both have said it, you're like the plumber in the body. You go in and you clear you remove plaque in certain problematic areas, maybe some areas that where the blockages exist. But you not only work and treat, atherosclerosis, but then you also help individuals who have accidents and, or are having some sort of emergency. So it's not always related to lifestyle in the sense of what they eat or lack of exercise. But if someone had an accident somewhere, you treat that.
Yeah, I mean, so you can think in a very simplistic term, and I joke with my patients, "I'm going to go clean out your artery," but it's not as simple as that. I mean, of course, it's much more complex, but in a very simplistic manner, the blood vessels of the body are the pipes or the tubes that carry blood
Hmm.
both from the heart and to all the areas of the body, and then back from those areas of the body back to the heart. And the heart itself, in a very simplistic manner, is the pump that is functioning, that creates the circulation throughout the tubes of the body. So that is a pretty straight, simplistic way of looking at it. And then, yeah, I mean, I treat both the chronic illnesses
Hmm.
that we treat today of the arteries, but then also, of course, I treat the acute injuries. If someone has a car accident and injures an artery, or a gunshot wound to an artery, or a stab wound. So I have stories about all of those things that I probably shared with you at some point or another. So yeah, there's both acute injuries to arteries, and then there's the other kind of traditional chronic
Right.
stuff.
Yeah. I remember there was one story that you shared about it, a young man who was a carpenter. He was working on location and he accidentally I think, put a nail through through his the palm of his hand. I don't remember what area. Can
Yeah.
you tell us about that?
Well, it was close. It wasn't the palm; it was his wrist.
Oh, it
And,
was the
and yeah,
wrist.
and he
Okay.
had injured his radial artery. It's the one that we all know, and we feel the pulse in the wrist.
Yeah.
So yeah, he had injured the radial artery, and I had to deal with that.
So what did you do? Just so that my listeners can have an idea of your specialty. Like, did you just did you repair the hand? Was he able to get full use of it or what happened?
Well, actually, when I went into and explored, I also had to assess whether he had not just an injury to the artery, but also the artery and the vein, and then also the neurologic assessment of his function as well,
Oh, okay.
because a lot of times the arteries, nerves, and veins all travel together. And so there are different ways to treat a radial artery injury.
Hmm.
Sometimes you go in and you can just tie off the artery and stop the bleeding if necessary. Sometimes you have to go in and repair it. A lot depends on what that repair will do to the function of the hand as far as its blood supply.
Wow.
In that particular case, I was able to repair the artery instead of having to
Mm.
tie it off.
Wow. Wow. This is incredible. And also just one other thing about what you do is you work very hard in saving limbs, especially for people who are diabetic or start to,
Hmm.
to have blockages in their legs. You what tell us a little bit about that because I know that's important to you. We've had this conversation before that once a patient loses a leg, quality of life drops even more because now they're probably wheelchair bound.
Yeah, very much so. A loss of limb is a tremendous impact on a person's lifestyle, on their psyche. It
Mhm.
affects so much of a person's life, and it's pretty much a downward trajectory on most people's lives when that occurs. I do a lot of leg work. I joke. There's
Yeah.
a joke that I'm a leg man, and so the vascular involves all the blood vessels in the body. So my training involves treating carotid arteries to both treat strokes and try to prevent strokes. I also treat the aorta, either whether it's blockages or aneurysms of the aorta. I also treat the lower extremity or leg arteries. And my practice has I also do a lot of dialysis work where I create the shunts and the fistulas and in order for people to have dialysis. So those are kind of the major things that I do. But over the years, my specialty, I have subspecialized within my specialty to where the vast majority of the work I do is what's called limb salvage work.
Mhm.
And so I deal the vast majority of the time with people who have problems with the circulation of their legs,
Mhm.
and very often circulation issues which are so advanced that their limb is at risk. My practice is what's called a limb salvage practice.
Yeah.
I'm in the business of amputation prevention.
Mhm. Yes.
Yeah. And
Yeah.
so diabetics, to further elaborate on that, diabetics are particularly at risk because diabetics develop, issues with wounds all the time as secondary to the nature of their diabetes. But if you add on top of diabetes, you add blockages in the arteries, we're talking about a very, very serious situation here. So diabetics are at particularly high risk for amputations, and they are the subset of the population that has the most amputations.
Yeah. And it's so hard to know that you have worked with my mother and I often talk about my mom on the show and how important it is for her to have this lifestyle, the plant-based lifestyle so that she could not lose a limb because she had, significant blockages on one of her legs.
So yeah, in fact, treating my patients was one of the main reasons I got into nutrition as a modality to assess and treat my patients.
Mhm.
In addition to me fixing their advanced problems,
Mhm.
I began to understand how much nutrition impacted our health, and over the years, I started to look at the evidence, the scientific evidence, and the best practices and evidence based medicine, and began to realize that our nutrition has such a tremendous impact on these diseases and risk factors that I treat. Most of my patients are diabetic and have high blood pressure. They have high cholesterol. They have high fats. And all of these things are directly impacted by our dietary choices.
Mhm.
And so I have adopted the approach of using the science behind nutrition and evidence based uh, uh, nutrition in order to help my patients make better choices.
Mm. They're so lucky that you have that knowledge. I was recently speaking with Dr. Sarah Kassam, and she's in Canada, and it's the episode right before this one. And I said to her that every time a physician joins, this lifestyle, I feel like a star lights up in the sky. And that's because you're giving us more tools so that we can take control of our own health. And that's what we'll be talking about today. We're going to talk about nutrition, more specifically soy and how it's beneficial. We'll address some of the myths because, many people are afraid of soy, not just women. Men are also told that they can grow man boobs. That's some of the things that we hear. So, should we get started on the topic?
Sure, absolutely.
So I thought I would do like these rapid fire questions, and you can do yes or no. Uh, and just to kind of get started, because I'm assuming that a lot of people may have these kind of questions about soy, so you can answer yes or no. But
And that's it, or can I talk some more?
we're gonna elaborate. But feel
Okay.
free to say more if you want. Just a couple of questions. So, soy products, more specifically tofu, but just soy products increase estrogen levels. True or false?
That is false.
Okay. Uh, I already said this one, but soy products increase or can actually contribute to men growing boobs.
That is false.
Soy products are excellent for women going through menopause.
That is true.
Okay. And let's see what other things. I can't think of any others because actually didn't prepare for those. But no, this is a great way to get started. So, as I was saying, we just completed the conversation in October of Breast Cancer Awareness Month. And the reason that I wanted you to talk about soy is you've addressed it before when we've done the walk with the doc.
Hmm.
And I know for another summit you spoke about soy. And actually, I guess if you wanted to talk about your general experience as a general surgeon, and if you've had experience seeing breast cancer patients or anything like that, if you'd like to share that first before we start.
Sure. Yeah. So, I do have some opinions and knowledge and information on soy, and actually my opinions are based on science. So it's not. I don't think they're opinions. I think they are recommendations because I focus a lot on nutrition in our health. Obviously, soy is going to come up as a part of that, and I have learned a lot about it. And so I do have recommendations about soy, and I think probably a better understanding of soy than most physicians do. So I feel like I can make some very good recommendations. My experience with breast disease and in particular breast cancer is related to my experience as a surgeon. And I did 5 years of general surgery training. And in that training, one of the areas of focus is breast cancer and breast surgery. So I do have a fair amount of training in that area. Now, I did not continue that training, or I did not continue that practice. As I developed into vascular surgeon, I continued and focused on vascular surgery and gave up breast surgery. And so I don't do that currently, but I do have some background in breast surgery.
Yeah, well, I think this is great. And you gave a talk, and then you and I sort of debated on the approach that we should take. Should you just redo the talk and record it, or should we have a conversation? And I thought it'd be great to have this conversation so that we can share it on social media and on the podcast and on the YouTube video and all of that. Let's start with some of the fears, I guess. And I do have some notes here, just because there's so much to talk about. But I thought we could start with probably addressing some of the myths that, like what I said earlier. Why are people afraid of soy? What do we know about soy in terms of the benefits? And how can we encourage people to feel like it's okay to eat soy?
Well, I think that just at its very root, the basic fears about soy come from this belief that people think that soy equals estrogen, and therefore soy consumption is equal to estrogen consumption. And then people may get the complications related to estrogen consumption that they are afraid of. Things like breast cancer recurrence, decreased fertility, early age of menarche, and in men, feminization. So
Yes.
those are the things that people are afraid of uh, from eating soy because they think soy equals estrogen.
Mhm.
And so I think the thing that the distinction that I like to really clarify is that soy does not equal estrogen. In fact, it's the exact opposite. There's two reasons this misconception exists. Number one, the the compound in soy that people are afraid of is something called a phytoestrogen. And just because it has that name estrogen in it, somehow people think, okay, because it's got that term in it, it must be an estrogen or have estrogen like
Mm.
impact.
Mhm.
And so soy has something called isoflavones, which are good are phytonutrients. And of course, all plant-based products have phytonutrients, and these are very, very healthy for us. And in particular, soy has these isoflavones, which are also in many other plant-based foods. And in particular, the isoflavones that we're talking about today is phytoestrogens. The reason they're called phytoestrogens is because they have some similar basic structural components that look like estrogens, but then they have more to it. So they're a plant estrogen. And I'll address that more as to what its effects in the body are. But the other reason I think that people fear soy is because early on in some of the research that was being done on soy, there was some papers, and in particular by one particular author, that talked about the estrogens or phytoestrogens in soy, and they made a leap of faith saying that those phytoestrogens were equivalent to estrogens. And then that kind of got hold in the popular culture. And so everyone was walking around saying, don't eat soy because it has estrogen in it. Okay.
Mm.
It caught interest. And I think, again, it got some momentum, I guess is the way to put it. And so it was something that has kind of stuck in our popular culture for many decades. And this research has subsequently been debunked.
Mhm.
Okay. But just because something's debunked, the original idea may not have faded away. And so that still exists out there. Now, what I will say is that there has been a tremendous amount of research done on soy. It's one of the most common plant-based products out there in many cultures and for many reasons. And therefore, and so it's not strange to understand that there's a lot of research done it. My understanding is that there's about 2,000 papers, scientific papers annually on soy. I used to say that there's over 40,000 papers on soy that exist out there, scientific papers. So,
Mhm.
that's a lot of information. And so the more recent data and the preponderance of the data shows that soy, not only is soy not harmful to us, that it's very highly likely that soy is beneficial for us. And
Mm.
we can talk about how it's beneficial to us.
Sure. Well, thank you for sharing that. Two reasons why people are afraid of consuming soy. It's just really not understanding the mechanism, and you are going to go in detail about that. But phytoestrogen, phyto meaning that it's derived from the plant, correct?
Yes.
So it's a plant estrogen, sort of, or mimics estrogen.
I wouldn't say it mimics estrogen. I would say it has some chemical and structural similarities to
Okay,
estrogen.
good. Thank you for correcting me. So that's one. And then the other one is just the media. I feel like the media intentionally targets soy as thinking that that's the main food that you and I as vegans eat. But I would say in the years that we have been vegan, we don't consume that much soy.
I think we probably consume a reasonable amount of soy, but I don't know that the media is out to particularly demonize soy, but the media always loves things that are controversial, things that'll
Mm,
stir stuff up, things that'll get people's attention,
yes.
and certainly it does do that. And especially if soy is out there, and if the media says something like soy is bad for you, suddenly it gets a lot of people's attention, and a lot of people will read those articles.
So when we start to move into discussing about the benefits of the isoflavones, the phytoestrogen found in tofu, I also want to address flax seeds
Hmm.
because flax seeds are just as beneficial. And I didn't know until I started doing some reading why it makes sense that Dr. Michael Greger recommends flax seeds as part of his daily dozen.
Hmm.
And it could be for this reason as well. I mean, flax seeds have so many benefits, but I'm hoping that you can talk about that
Yeah.
as well.
Dr. Greger, when he had to come up with a few foods that would be, superfoods or the ones that you need to kind of focus on a daily basis, it doesn't surprise me that he picked flax seeds, just like he picked blueberries, and
Yeah.
so it's just like there's it is, in my opinion, a superfood, and it has a lot of beneficial effects. And okay, so again, let's not forget to talk about that.
Yeah,
Uh,
yeah.
I can talk about the what soy does in the body at a biologic or molecular level, and then what are the studies about soy? Because I think those are two important things to really understand if you want to really grasp the fact that soy is not only not harmful for you, but that it's beneficial.
Hmm.
So when you eat soy, that's what comes into the body as a phytoestrogen. So we have two different estrogen receptors in the body. There's an estrogen A receptor and there's an estrogen B receptor. And estrogen itself has a high affinity for the A receptor. Uh, the phytoestrogens that we get from soy actually have a fairly low affinity for the A receptor and a very high affinity for the B receptor. So then, what about these receptors and what do they do? Receptors are like keyholes or buttons, and so when something binds to them, or it actually activates whatever that receptor is responsible for. So when something binds to the A receptor, the estrogen A receptor in the body, it
Hmm.
actually has very strong pro-estrogen like effects. And so that's why when high estrogen might turn on growth factors, might turn on cancers, it turns on estrogen things in feminization. So anything that's binding in high levels to the A receptor causes those traditional estrogen like effects that many people talk about.
Is that alpha receptor what receives our estrogen in our body?
Yeah. So estrogen binds strongly to the alpha or A receptor.
Okay.
Yes. And then now phytoestrogens uh, bind with a multiple thousand-fold higher affinity for the beta or B receptor. Okay. Now that beta or B receptor has relative anti-estrogen like effects in the body. It actually kind of blocks the estrogen effects or turns off the estrogen effects. So you can see that a phytoestrogen doesn't have the proestrogen effects because it doesn't bind strongly to the A receptor, and it has anti-estrogen effects because it binds to the B receptor, which turns on the anti-estrogen pathways. And so, therefore, it's thought to be protective in many respects against those estrogen positive type of problems.
Mm.
Okay, in particular, breast cancer, feminization, early menarche. Okay, and then in men, there's a thought that it can be protective against prostate cancer.
Oh, wow.
Yeah.
And the way that you're describing it, it almost sounds like if we have this A receptor and B receptor, that we should be consuming phytoestrogens. It sounds like.
So, yes, I think we should be. And
Mhm.
I make a personal recommendation that we should be consuming 2 to 3 servings of soy products a day. Uh,
Okay.
and so now, so let's kind of just use that as a segue into the literature.
Okay.
So there's again, like I said, there's a lot of literature out there, and when I say literature, I mean scientific literature. I'm not talking about some article on
Mm.
Yahoo that just is talking about soy, but I'm talking about the scientific literature. And then there's a lot of and not all scientific literature is great, but there are lots of good peer-reviewed articles out there, and there's lots of great meta-analyses out there that have shown the positive benefits of soy. And so, in particular, I like to quote that uh, women who get more soy, and it's you have to look at population studies and epidemiologic studies in order to get these results because it's very hard to design randomized control trials and placebo control trials to show any benefits because you would have to do these for years and have tight controls. So these are both mostly based off of epidemiologic and population control studies or studies. But the studies show that women who consume more soy as opposed to no soy, and typically that means 2 or more servings a day, have a 30% less risk of developing breast cancer over time. And a lot of these studies are look at Asian women and Asian cultures because there is a lot of soy consumed in those cultures. Uh, I can tell you that the American Institute for Cancer Research and the American Cancer Association both say that soy is safe to consume for women in all
Mm.
stages of life. And then there's also studies that show that soy consumption in women who have had breast cancer, those women who consume the highest levels of soy have about a 30% less risk of cancer recurrence and have a statistically significant less risk of all-cause mortality
Wow.
as compared to women who do not consume soy.
All-cause mortality. So you're saying that soy not only is protective against recurrence of breast cancer, but it also protects our heart and other
Well,
things?
so so when you say all-cause mortality, then there probably is some sort of general protective effect,
Okay.
or some processes in the body that, and we can talk, we will talk about this, but soy is also helps lower cholesterol, and then we were going to talk about. There's also some thoughts that it decreases blood pressure.
Mhm.
Okay, uh, so we're talking about scientific studies here that show that soy consumption decreases breast cancer incidence
Mhm.
and is protective against recurrence of breast cancer in women who have had breast cancer. There's another study I like to talk about, and that looked at the Far East Asian cultures and looked at soy consumption in teen and preteen girls.
Mm.
And so, girls who consumed 2 or more servings of soy a day, as compared to those who didn't, throughout their preteen and teen years, had a 30% less risk of developing breast cancer over the course of their lifetime.
Wow.
So there's something about during those developmental years when the breast tissue is being developed that exposure to the soy and most likely the phytoestrogens
Mhm.
reduces the risk of breast cancer over the course of a lifetime.
That's
Yeah.
incredible.
So, I mean, what is happening when people develop cancer? We are actually all developing uh, abnormal cells and cancers in our body all the time. It's up to our body then to defend and protect against those. It's to recognize them and weed them out. So we have an
Right.
immune system and a defense system that's always fighting cancer. And so I think two things are happening when we consume soy. Number one is we're consuming the phytoestrogens, which are protective against the development of the breast cancer tumors. But we're also, people who consume more soy tend to, and who are more plant based or plant forward in their nutrition, tend to eat less of the harmful foods that promote cancer development.
I'm thinking about the standard American diet, the everyday diet that people eat when they're on the run, when they're very busy. A lot of people, and I talk about this often, but a lot of people eat fast food. When are they going to get soy in their diet if they're constantly eating out? When you go to restaurants, soy, for example, tofu is not always an option in a restaurant. So, what you're saying is we have to be very deliberate, not only understanding the science that this is beneficial for us, for women. And you know that on the podcast, I like to emphasize and support women in health. So, when we're talking about health, we will have to be more intentional about bringing in tofu and edamame into our diet.
I agree completely. I think we have to be intentional about everything about our diet. In
Hmm.
today's day and age, it's too easy to eat in an unhealthy way.
Yeah.
And we do live in a very much a fast food culture. It's a lifestyle and a culture that's developed, and so it's just very common for all of us
Mhm.
to eat on the run and not pay attention to making great choices about our food choices because we're always in a hurry, and we haven't focused on food as we should, realizing how important it is to our overall health.
Yeah.
And I think we need to get back to that. So, as a part of that, I think that we need to be intentional in our food choices, so add soy to our diet. What are the things a woman can do to uh, reduce that breast cancer risk? I'm very much uh, a proponent of trying to detect and treat breast cancer or in cancers in general.
Mhm.
Cancers are going to develop, and our healthcare system is getting better and better at detecting and treating cancers in general. But what I also think we should focus on, and this is
Mhm.
really where I is wouldn't everybody rather not get cancer? So, wouldn't it be more important than to try, if we know how to prevent it, shouldn't we also focus then on trying to prevent cancers from occurring? And we can help people on both sides.
Mhm.
And so, there are things that you can do to prevent breast cancer. And you've probably talked about this on some of your other episodes that you
Mhm.
did
Mhm.
during Breast Cancer Awareness Month in October. But I don't think it hurts to talk about it again. And I'm a supporter of the a Physicians Committee for Responsible Medicine's approach. And they talk about 4 things that you can do. and we can talk.
Mm-hmm.
We can
Yes.
expound upon them if we want. One, of course, is to choose plant-based foods or have a plant-centric diet, because a plant-based diet is healthier for you. It's full of phytonutrients and antioxidants.
Mm-hmm.
It's high fiber, it's low fat, it's low cholesterol. All of those things are protective against cancer. Another thing is to exercise regularly. The third thing is to limit alcohol, because we know that alcohol increases estrogen, which puts a woman at higher risk for breast cancer. But alcohol itself is also a cancer causing agent. It causes multiple cancers, and there's also known to be increased breast cancer with increasing alcohol
Yeah.
intake. And then the last thing is to maintain a healthy weight. We know that people who are obese are at higher risk for breast cancer. My thought on that, and I think the prevailing attitude on that, is that people with more weight have higher adipose and fat tissue is well known to produce estrogen, and therefore people have higher estrogen exposure and therefore more breast cancer.
Mm.
So those are the kind of the four things that I
Yeah.
support from the PCRM, or Physicians Committee for Responsible Medicine, and then I also add don't smoke,
Mm.
because it's just a no brainer. Tobacco is very bad for us. It's not just bad for your lungs. It's not just bad for your heart and cardiovascular disease, but it causes multiple cancers.
Mm. Yes. Thank you. Yeah, I like those four tips, especially the one on just incorporating more whole plant-based foods. Since you've already given us the evidence behind that, you've given us some science and talked about studies that show that not only are soy products not harmful, but they're beneficial for our health. I'm wondering also if we can then continue this conversation by talking about the concern that people have about genetically modified soy. So that's one. And then the other one is the isolated soy protein, which, believe it or not, I did not know what that was. And I remember someone asked us once about isolated soy protein, and I said, "What's that? Where do you find it?" Because I don't buy products that are isolated soy protein. I mean, I don't even you definitely that would be found in processed foods more than
Right,
anything.
right. Well,
So,
isolated soy protein by definition is a highly processed
yeah.
food. Yeah, so to kind of just address this person you're talking about, I think that the people who continue to avoid soy or are afraid of soy have heard something out there in the media, but
Mhm.
haven't done their research. Because clearly, if you've done your research, you know that soy is not only not bad for you, but it's better for you. Again, what woman who has had breast cancer would not want to reduce her risk of breast cancer recurrence by 30%
Mm.
by doing something as simple as having 2 servings of soy a day?
Mhm.
That's not it's not tamoxifen. It's not some estrogen blocker that you have to take that has other effects on your body. It's not some big anti-cancer chemotherapy treatment. Okay.
Mhm.
It's something as simple as eating edamame and a glass of soy milk, or
Mhm.
edamame and a serving of tofu every day. And you now have almost nearly halved your risk of having recurrent breast
Mhm.
cancer.
Mhm.
And that's what the data shows, the science shows. And so I just think that the people who say that have not researched it, then they're just basing it on some anecdotal story or just something they heard,
Oh,
and that's a shame.
right.
Yeah.
That's one. And then they're probably also thinking that when we're talking about soy, we're talking about highly processed soy products that are turned into burgers or whatever that may be. And
Well,
then of course I would say, yeah, try to minimize even the vegan processed foods because they're still going to have a lot of chemicals and additives that we don't want to consume.
and I wish that were the case. If that were the case, they would say, "Yeah, I stay away from highly processed soy products." No, they just say, "I don't eat soy,"
That's right.
because
So
I
it can
think,
be in any,
yeah,
yeah.
I think they're still afraid of it because, yeah, I mean, of course, we advocate for the things that are closest to their natural state.
Mhm.
In fact, when we talk about eating soy products, we talk about let's eat edamame, the soybean,
Mhm.
or tofu, which is minimally processed, or soy milk, which is minimally processed. Okay, or tempeh. Okay. So those are the kind of things that I recommend. I'm not talking about the highly processed soy foods. If there's soy in an Impossible Burger, I don't think that's the best way to get your soy. Okay.
Mm.
Sorry, Impossible Burger. But them, you were also then, uh,
Genetically,
yeah,
I was
you
mentioning
mentioned you
genetically.
mentioned GMOs. Now, GMOs are something that I've considered, and I don't know the right answer. I think that what I tend to tell people is that I avoid and don't recommend GMOs because we don't know what we don't know. I'm in favor of avoiding those at this
Hmm.
point
Yeah.
in my evolution of thought. Something that I think is very interesting is that there are people who don't make a distinction when they're eating meat. They don't. They're very anti-GMO, and they'll say, "I don't want any GMO products," but then they're eating meat,
Hmm.
and the vast majority of livestock out there today are fed GMO products. And so they don't even make that connection that what they're eating is based on a genetically modified product.
Right.
And and so that's, let alone the fact that they don't make the connection that the protein they're getting from their meat actually came from plants anyways. So there's a lot of disconnect out there in our world. So you also asked about soy protein isolate, as you know, and I'm not so much speaking to you as to our audience.
Hmm.
We advocate for a whole food plant-based lifestyle, and that involves minimally processed or no processing or minimally processed foods. So we are not advocates for processed foods. And I'll give you an example of a highly processed food: oil. It doesn't matter where you take it from, whether it's an olive or an avocado or corn. Um, Oil is a highly processed food. You've stripped out all of the fiber, the phytonutrients, and everything else, and all you're
Hmm.
left with is an oil or the fat from that product.
Hmm.
So, similarly, soy protein isolate is stripping everything from the soy or the soybean and only leaving the protein behind. You've taken out the fiber, you've taken out all of the other products,
Hmm.
and all you're left with is a protein. And in my opinion, and I don't think it's in everybody's opinion, that's a highly processed food. So I'm not a big fan of approaching food from that standpoint.
So that topic has come up, and that's why we're talking about it. It's come up as to, well, what's wrong with that? It's not all that bad. And it wasn't until it was sometime earlier this year, I guess, a guest came on to talk about soy as well and address the isolate and said that the process of extracting the protein, just like you described, puts the product at a kind of carcinogenic, if I'm saying it right, state because of some things that form like hexane, and I don't even know what that is. And one other thing, do you know what I'm talking about?
I think those are products that are used in the processing of the soy in order to create soy protein isolate. And so it could be that there's contaminants left in it, and therefore, that's why we talk about all these processed foods and preserved foods that you buy off the shelf. They have lots of chemicals in them,
Hmm.
and they have preservatives in them,
Yeah,
and they have things in them that you can't pronounce or you don't even know what they are.
yeah,
And so, why would you want to be putting those in your body?
that's right.
So again, I'm not trying to denigrate or denounce soy itself.
Right.
I'm just talking about we don't promote eating a highly processed soy food.
Right. Well, let me say this one. Because I thought it'd be interesting for people to know the process of extracting the soy protein is that so just like Dr. Riss had already said, is what remains when you take soybeans and strip all the sugar, the fiber, and all the natural vitamins and minerals from them, what is left is the protein. So the process of doing all of this is called acid washing. Soybeans get soaked in acid or alcohol to remove the sugar and dietary fiber. Then what's left gets dehydrated, which ultimately makes a dry powder, and it looks like an, I don't know, Olay protein powder. I don't know what that is. The extraction process often leaves behind residue from chemicals and metals like hexane and aluminum. And it also contains phytates, also known as anti nutrients, which reduce the body's ability to absorb iron and zinc.
That doesn't sound too healthy.
Right. And then I read that this is found in the Impossible Burger.
Well, the Impossible Burger is, although it's plant based and or vegan, it's a very highly processed
Hmm.
product. So it's certainly not a whole food product.
Yeah. The other thing that I read about the isolate is that it causes a surge in insulin levels. So, the Mastering Diabetes team recommended that people stay away from the isolate if possible. And again, I didn't even know what it looked like. Like, how do you buy it? Where is it found? But I guess just read the labels and see if it says isolated soy protein, and then that's how you know. But I guess, I mean, does Impossible Burger have that in its list of ingredients? I don't know.
Yeah, no, I don't know either. I
Yeah,
think the place that I've looked for soy protein isolate is in milk, soy milk, and so you want to make sure that you're buying a soy milk that's pretty much as natural as possible and doesn't have the soy protein isolate in it,
okay.
as something that's being reconstituted, or other preservatives.
Yeah. Okay. So I hope we
Obviously, the best thing to do is make your own, but then again, how many of us have time to make our own?
That's right. I hope that we explained a little bit about the isolated soy protein for people, because I think that, okay, so we know that about soy protein. This is probably the information that's fed to the general public who's fearing soy, is that they're thinking that this is the soy that we're eating. And what we're saying is no, go to, your local natural grocery store and find the one that comes kind of sitting in its liquid. That's as close to whole as you can. But really, the edamame is the best way to consume. And, I don't know if I ever told you, Dr. Riss, but there was a time when a friend of mine and I would go to this restaurant and we would ask for the edamame before people started adding spices and all of that. We did it first. Many, many years ago, we were like, can you put some spice in that? Because we're Mexican and we like it. And I was eating edamame just like that. You know how you can eat one after the other, almost like chips, and they're enjoyable to eat. Or you can, buy them already frozen or in bags and sprinkle them in over your salad or in a soup, or have the tempeh version, which you, Dr. Riss, enjoy.
Yeah, no, so I think I can out eat you with the spicy edamame. That's I don't think we ever pass up an opportunity to order edamame if it's on the menu,
Right.
because it's a good appetizer and we enjoy eating it. And
Hmm.
I certainly enjoy the spicy edamame. It's a good way too not to have the salty edamame, which has a lot of we try to avoid salt.
That's right. Okay. Just a couple of other things as we're moving along is, can it help with menstrual cramps? That's, for women that are in that age group. And then can it help with menopause, like reducing hot flashes?
Yeah, so there's some studies out there that show that phytoestrogen exposure does decrease the menopausal symptoms,
Hmm.
uh, and in that particular, much like estrogen does. So in
Hmm.
this particular case, the phytoestrogens are activating pathways that reduce menopausal symptoms or discomfort. Okay, there's another study out there that shows that flaxseed is beneficial to women in menopause. And okay, so that's a good reason to talk about flaxseed because we brought it up earlier. And so flax seeds are considered, in my opinion, are a superfood.
Hmm.
They are high in omega-3 fatty acids, which are extremely important to us. But they also are high in lignans. Lignans are another phytonutrient.
Hmm.
Okay. And these lignans are converted in our intestinal tract into phytoestrogens. So flax seeds themselves don't have phytoestrogens in them, but they have the precursors of phytoestrogens.
Okay.
And then the good bacteria in our gut, in our microbiome, then convert those lignans into phytoestrogens. And their potency is hundreds or thousands of times more than many other foods. So that's why flax seeds are kind of a superfood. And then these have
Mm.
beneficial effects. And my understanding is that they do decrease menopausal symptoms. The other thing I've read about is there's some studies that show that phytoestrogen exposure in plant foods decreases fibroids in women. Okay, so that's a little known fact, and not many people talk about it. But women with higher soy exposure and phytoestrogen exposure experience less problems with painful fibroids throughout the course of their lifetime.
That's great news.
That's particularly interesting to me because I often get referred women with painful fibroids, and I have to go in and what's called embolize the
Mm,
artery that leads to the fibroid in order to try to kill it. It's a less invasive, non-surgical way to treat fibroids, and I will be very honest with you that I haven't sent these women away on a plant-based diet, because it's been so few.
mm,
And I think the reality is many of them won't adopt the therapy
mm,
when they want a treatment for it. But there is data to show that there is decreased fibroids or decreased painful fibroids on a plant-based diet.
mm. This is such great news because again, it just it feels like the power is back in our hands, that if we know these things, that we can help our health, without relying on necessarily medication. Because, for example, I don't like to take painkillers, and when I say painkillers, I'm talking about aspirin or Advil. I don't even like to take that, but most of my life I struggled with painful cramps and acne. And I'm thinking the estrogen was probably the contributing factor to those things. I don't know what other kind of mechanism could have been in place, but I know that I never really had any kind of serious issues like fibroids or anything like that. But I transitioned to a whole food plant based diet just before I started going into menopause. So it's a little hard to say how much improvement I've seen as a result. But I know that my acne cleared because you probably remember I suffered with acne for many, many years. And so if women can help themselves by having, for example, less painful cramps, menstrual cramps, or fibroids, or even, I don't know if it helps with painful breasts, like if you have fibrocystic breasts, if it can help with, if soy can help with that as well. I don't know.
Yeah, no, I don't know the data on that. Although I do know that, fibrocystic disease of the breast is a hormonally driven problem,
Yeah.
and it's often worse during, related to a woman's menstrual cycle.
Yes. Oh my goodness. All the things I wish I had known all of this many, many years ago. But I must have known something because I stopped eating red meat and pork a long, long time ago. Okay, just I want to make sure that we're not forgetting anything. But you mentioned flaxseed, and I want to kind of throw this story out there to see if you remember. I had a doctor friend who lived in Austin, and I won't say his name just out of privacy, but during that time, I introduced him to flax seeds because my friend kind of was having some constipation issues.
Hmm.
And me being the person, and this was many years ago, me being the person that likes to help people with the holistic approach, I prescribed him um, flax seeds, and I actually got him some cereal and flax seeds with to go along with that. Anyway, he was like, within 1 or 2 days, he was like, "It's a miracle! It's amazing! This stuff works! This is wonderful!" He was thanking me, and about a week later, he comes back and he says, my friends told me I'm going to grow man boobs. I'm
Mm.
not going to take flaxseed anymore. And I was thinking, oh my God, this is what misinformation does. The average person that doesn't read the literature, because most of us get our news from television, um, it's amazing
Or
that,
other friends like him.
or other friends. And then this was a doctor who
Hmm.
could have done the research on his own, and maybe even the literature is biased also against flax seeds, just like maybe
Uh,
soy. I don't
I'll be
know.
real honest with you. I have never seen any literature that says that consumption or even high consumption of flax seeds causes feminization
I
in men.
know.
I've never seen that. So, and I think if that literature existed,
Mhm.
people would be grasping onto that.
I know. It's just so disappointing, but anything that we say, we can always say, hey, go to, PCRM's website to obtain the studies related to this, or American College of Lifestyle Medicine puts out a lot of literature as well, or references it. So we'll always, if you want to know what studies we're referring to, we can give you that information. Maybe in the future, I can start placing that information on the website, so that people know that we're just not making this stuff up. Okay, just a couple other things. I don't know if I'm forgetting anything else. There was some concern about thyroid and soy. And I was initially concerned as well because I have had hypothyroidism. But I think that if we have thyroid issues, that people believe that maybe the tofu can interfere with our absorbing the iodine or something like that. So we're just encouraged to eat more nori sheets or
Yeah.
something.
So there are studies that have studied thyroid function with increased soy intake, and they have shown that there is no negative impact on thyroid function from the consumption of soy. But there is one concern: is that there is an iodine binding effect of soy that might reduce one's exposure. So in those situations, they do recommend that you just try to increase your iodine intake. And of course, we recommend doing that through seaweed based consumption, like nori
Okay.
sheets, for example.
Awesome. Other health benefits can be associated in terms of consuming soy products is that they help to reduce inflammation and improve our cholesterol levels. And I was wondering if you wanted to talk a little bit about how cancer feeds on cholesterol.
Let's talk about both soy and flaxseed. Soy consumption has been, of course, shown to reduce your cholesterol, and it's also been shown to reduce your blood pressure.
Hmm. Hmm.
And these are in studies as well.
Hmm.
And then also, and so that the cholesterol part of the soy consumption it can likely be beneficial in cancers because many cancers are like cholesterol. They eat the
Hmm.
cholesterol and they grow from cholesterol.
Hmm.
So if you reduce your cholesterol, you can starve a cancer. Back to the lignans in flaxseed. Flaxseed has been shown to be a very potent blood pressure reducing solution as well. Again, reducing your blood pressure by up to 10%.
Hmm.
So somebody who has a blood pressure of 150 can get their blood pressure down to 135 just by eating a tablespoon or two of ground flaxseed on a daily basis.
Right.
You don't have to take any medications.
Hmm.
Uh, and just think about somebody with a blood pressure of running 150 and you want to get your blood pressure down to 125. Uh, you make some lifestyle changes, start exercising a little bit, eat some flaxseed, do a few other things, which I could tell you, and you might not have to be on medications.
Mm.
You know,
Yes.
you can just reduce your blood pressure through lifestyle changes.
Yes. Well, I'm really excited about having had you on the show again because it's been too long. I know that I wanted to get you on before earlier this year because I thought I wanted you as my guest for episode 200 to
We
celebrate 200. Maybe you can come back when I celebrate 300.
better start planning now.
We better record it today, no, for the next time. But the other thing too is that I just celebrated 4 years, and in the past year, since I hired a team to help support me with a lot of the editing, I've put out a lot more content. And I was thinking, what do you think will happen in the next 4 years? Will I still be doing this? Will there be 4 more years of this? I don't know.
I don't know either. I guess we'll just have to wait and see. Stay tuned, everybody.
Stay tuned. But well, thank you, Dr. Riz, for joining us. Is there anything else that you'd like to share with our listeners? And then I'm going to make sure that I add your Instagram account because Dr. Riz's Instagram account, which is Dr. Riz, Dr. Dr. underscore RIZ underscore BUKHARI. Anyway, I'll include that in the show notes. So he's had a lot of activity in his Instagram account, and you can go check out the account and see how he's been advocating for healthier options. We recently did a protest at a hospital in Fort Worth where we basically, stood in there, and this was part of a Physicians Committee for Responsible Medicine. We were out there protesting the McDonald's, asking the hospital to do better for the patients, because we know that when patients or anybody visits that hospital, the first thing that they'll see is the McDonald's. And when a hospital has a McDonald's there, it's almost like they're saying, hey, this is the kind of food we think you should eat.
Yeah, we condone that.
Yeah.
Yeah.
It was horrible. But lots of activity on your Instagram so people can learn about that. And you also have a guide, Dr. Rissa's guide.
To cardiovascular nutrition.
Yes. So we're going to put a link. So if you're interested in learning more about Dr. Riz and his recommendations for lifestyle medicine that can help you all around, all the things that you can do to take care of your health, you can follow him or download the PDF as well. But is there anything else that you'd like to share with us?
I'd like to talk about the big picture. And, we're talking today a lot about soy and breast cancer and specific, kind of some specifics. But what I like to tell people and help them understand is this lifestyle that we promote. First off, kind of the healthy lifestyle, which includes a plant centric diet and avoiding toxic behaviors and getting sleep and developing relationships and working on your spirituality and avoiding, so those things, that's a kind of a lifestyle we preach. But in particular, the whole food, plant based approach to life, to nutrition, which is very scientific and evidence based,
Hmm.
is kind of a one solution fits all. Okay. You don't need to eat one particular diet for your heart, another particular diet for your breast, another particular diet for your prostate, another diet for your gut microbiome. This kind of must have been the way it was intended to be, because it's one diet that provides for tremendous overall health for the body.
Hmm.
And
Hmm.
so I just like people to kind of grasp that concept. It's a whole food, plant based centric lifestyle is the healthiest way to approach your life.
Yes. Thank you, Dr. Riz, because I know that when my listeners hear it directly from a vascular surgeon who treats advanced cases, diseases that people pretty much brought on themselves by making lifestyle choices, certain lifestyle choices. I know that when they hear it from you, that they really get it. They can hear all day long from me, but I think it's important that they understand that the surgeon actually is telling his own patients that these lifestyle modifications, the lifestyle medicine pillars work. They help in, like you said, in preventing disease and hopefully preventing recurrence or even the diseases from advancing, hopefully preventing that as well. So,
Yeah, and unfortunately, many times for my patients, it's very late in the process, and the lifestyle they've been leading for decades has led to a point where they can't avoid being on my operating room table and
mhm,
under my knife, and the complications of that lifestyle when they're in their 60s and 70s
yeah,
and 80s. But what I'm hoping is that many of you out there who are younger than that and listening to this
mhm,
um, can adopt positive changes that can change the trajectory of your life and keep you from ever ending up on my table.
yeah,
And I think that's important. I will say, though, it's well known and scientifically proven. Again, adopting a whole food, plant based lifestyle at any stage in your life results in a healthier life at any point.
yes,
What I'm saying by that is it's never too late.
yes. People do not want to end up as your patient
No,
because by then it's usually too late.
yeah, if people only knew before they were my patient that they didn't want to be my patient, they would do everything in the world to avoid being my patient.
That's right.
Okay,
Yeah.
it's not unusual for me to ask a patient, if you knew how to prevent being where you are today,
Mhm,
if somebody told you there was a way to stop, to not be here, if there's a change you could have made 3 decades or 4 decades ago, would you have done it? And they uniformly say yes.
mm,
Okay. Now, the problem is, once they've encountered the complications of that lifestyle, then they go back and say, yes, I wish I would have changed. But
mhm.
what I want is for people to make that change before they encounter those complications.
That's right. That's right. Wow.
Yeah, I know. I think one of the frustrations that I can give you the perspective as a physician is, one of the perspectives that many physicians take
Mhm,
is they don't think their patients will make the change, and I can understand. But let me just say then, if I was the patient,
mhm.
I would say, please at least give me the information. Doesn't So don't not share the information just because you don't think I'll listen.
Yeah.
So our goal, or my goal, is to, even if is just to continuously present the information, the scientifically based, evidence
Mhm,
based medicine information to my patients, and hopefully, it'll plant a seed, and
mhm.
they'll make a change.
But anyway, we can go on. We're going to continue the discussion during dinner because we are getting ready to cook. Dr. Riz, thank you once again for coming on the show. I can't wait to see what the listeners say about this episode, and hopefully we'll catch you in the near future again.
Okay, thank you. See you on number 300.
Dr. Rizwan Bukhari is a vascular surgeon with over 25 years of experience. He's highly specialized in the surgical treatment of blood vessel disorders and the minimally invasive treatment of blood vessel disorders. Dr. Riz treats acute injuries to arteries and atherosclerosis related chronic illnesses. Dr. Bukhari is passionate about saving limbs and preventing amputations in his patients. He often says that you should do everything in your power to not end up like his patients. Many of his patients lose their quality of life once they have advanced diseases. He still advises his patients to adopt healthy lifestyle changes, such as those associated with the pillars of lifestyle medicine. He is also a strong advocate for using nutrition to treat various diseases and to reduce cancer and chronic disease risk factors. Today's topic, soy, is controversial, and Dr. Bukhari debunks some of its common myths. Here are a few things to remember regarding soy and estrogen levels. First, soy contains phytoestrogens, which are plant based estrogens. These estrogens are much weaker than the estrogens produced by the body and can help block the body's estrogen from binding to receptors. Second, soy can be beneficial for women throughout their lives. Studies show that consuming soy early in life can significantly reduce a woman's risk of breast cancer. Soy can help alleviate some symptoms associated with menopause, such as hot flashes and night sweats. Third, Dr. Bukhari recommends soy as a healthy part of a plant based diet. Soy can reduce the risk of many chronic diseases, including heart disease, stroke, and cancer. Soy products can help to lower cholesterol and protect against heart disease. Always consume minimally processed soy products such as organic tofu, edamame, and tempeh. They are a great source of protein and can be a healthy alternative to meat. Also, I'm going to put a link down below if you'd like to learn more about how you can prevent cardiovascular disease. Dr. Rizwan Bukhari also has a guide that you might be interested in. So make sure that you click on that link below. I'd love to hear about your experience with soy. Have you reduced your hot flashes by consuming soy? Tell us about a favorite meal that incorporates soy food. You can now leave me a voicemail at speakpipe.com/HLS. I hope that you enjoyed this episode. And as always, thank you for being a listener. You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave an honest review as well at ratethispodcast.com/HLS. This helps us to spread our message. And as always, thank you for being a listener.